Ensure that the drug is compatible with the primary running IV solution and with any other medications the patient is receiving. Prepare medication for only one patient at a time. Pause twice during your preparation to compare the medication label carefully with the medication administration record, or MAR.
Hello.
Hello.
I'm Jennifer. I'm going to be your nurse. I have an antibiotic now to hang for you.
Okay.
I'm just going to wash my hands and I'll be right back to do so.
Okay.
Administer the medication at the time ordered. This is especially important for stat and now doses. Perform hand hygiene and provide privacy. Identify the patient using 2 identifiers.
All right. If you wouldn't mind just stating your name for me, please.
Sylvia Cruz,
Okay, and your birthday.
12/30/55.
Okay, Sylvia, do you have any allergies?
No.
Ask her if she has any allergies. Compare the label of the IV medication with the information in the MAR. This is your 3rd accuracy check. Discuss the drug's purpose, action, and possible side effects. Explain that you'll be administering the medication through her existing IV line. Give her a chance to ask questions and encourage her to tell you if she feels any discomfort at the IV site. Apply clean gloves and assess the IV site for any sign of phlebitis or infiltration.
All right, I'm just going to check your IV site now.
Okay.
Is it tender at all?
No.
Okay, good.
Use an antiseptic swab to cleanse the IV port closest to the patient. Attach a pre-filled syringe of normal saline to the port. Kink off the tubing above the Y site, pull back slightly on the plunger, and assess for blood return. Then slowly flush the line with 2 to 3 milliliters of normal saline, following agency policy. Then withdraw the syringe.
Looks like it's working fine. We're going to get that antibiotic hanging now.
Connect the syringe to the mini infusion pump tubing and remove the cap, being careful not to contaminate it. Carefully depress the syringe plunger and let the tubing fill with medication. Then recap the tubing. Place the syringe into the mini infusion pump, following the manufacturer's specific instructions. Ensure that the syringe is secure. Wipe the port again with an antiseptic swab. Then connect the mini infusion pump tubing to the port of the main IV line. It's not necessary to turn off the running IV fluids unless they're incompatible with the medication you're giving. If you're delivering the IV medication through a saline lock, cleanse the injection port with an antiseptic swab and let it dry. Insert a pre-filled syringe of normal saline into the port. Unclamp the tubing, pull back gently on the plunger, and check for blood return. Slowly depress the plunger to flush the saline lock with 2 to 3 milliliters of normal saline. As you proceed, assess the IV site for infiltration. Then close the clamp on the tubing. Then withdraw the syringe, swab the port again, and let it dry. And insert the tip of the mini infusion pump tubing into the port. Secure the tubing to the patient with tape if necessary. Next, set the pump to deliver the medication over the period of time recommended by agency policy, a pharmacist, or a drug reference guide. Press the button on the pump to begin the infusion. Then remove your gloves.
All right, ma'am, you're all hooked up. If at any time you have that tenderness, swelling, or any discomfort on that IV site, please let me know.
Okay.
Stay with the patient for the first few minutes of the infusion to assess for a possible adverse reaction to the medication. Perform hand hygiene. Document the time at which you initiated the infusion. Once the medication has infused, perform hand hygiene and put on clean gloves. Remove the mini infusion pump tubing and cover it with a sterile cap. Ensure that the flow rate of the running IV is accurate and adjust it if necessary. Discard your supplies in the appropriate receptacle. Remove your gloves and perform hand hygiene. For a normal saline lock, disconnect the tubing and cover it with a sterile cap. Clean the port with alcohol and flush the saline lock with 2 to 3 milliliters of normal saline. The rate at which the line is flushed is not to exceed the rate of the medication infusion. Then remove your gloves and perform hand hygiene. As part of your follow-up care, reassess the IV site for redness or swelling. Evaluate the patient's therapeutic response to the IV medication, including any unintended effects.